Good afternoon. My name is Deborah Adams, and I'm honored to represent the National Association of Early Childhood Specialists and State Departments of Education. You'll find the 12-minute version of my comments posted on our website shortly after this meeting, but I've condensed it to the 4.5 minutes I have left. So as I was listening today, I actually kind of itemized the key words that are going to probably have a thread through all of our comments: leadership, shared vision, collaboration, coordination, relationships, messaging, professional learning, valuing our workforce, and utilizing brain research and child development. So I was glad to hear that my comments don't stray too far from those common themes that we've heard already today. So collaboration efforts get the work done. Therefore, we suggest that the committee consider a collective impact conceptual model to take a lens to your study. For example, to achieve a more seamless continuum growth and development for children age birth to age 8, it's going to take collaboration between families, community, and government. Think of this collaboration as the conceptual workforce, whose role is to positively impact the architecture of the development brain. It's going to take everybody's effort. So the family, meaning any configuration thereof, to support the nurturing need that will set the course for fostering health, trust, and resilience in our youngest learners. The community context that directly affects critical family supports, and the community context that supports out-of-home educational experiences for young children. And then the larger system of government that sets policies that affects families and the community contexts. We feel an outcome of your study can include strategies to help states message to families, communities, and government that we have a collective responsibility to support the positive experiences that shape the architecture of the developing brain. Together, we can make a profound impact towards supporting a continuum of growth for all children, especially those of high needs. But we need everyone's authentic engagement to do so. So that said, here are 4 considerations that can inform your study. Please illuminate the importance of the birth to age 8 continuum as the foundation for learning in later life. We don't need to delineate the ages, birth to 3, 3 to 5, 5 to 8, if we are really aiming at a continuum. It's that separation of those age pieces that I go back to Marcy's statements that kind of set a seam, and we can't ever truly get past that seam. State specialists face challenges in supporting a continuum of practices when the systems bifurcate by ages. So some of our government systems are set up because we think that our ages kind of are in blocks, and we don't need to be thinking of it in that way. Governance is critical in how we message this growth as a continuum and not as its parts. 2, address the role of leadership, especially in kindergarten through grade 3 arena, and the content as well as the pedagogical knowledge needed to sustain the trajectory of growth through the early grades. The Foundation for Child Development provides a good resource to address leadership and continuum supports. Many states are currently engaged in teacher evaluation systems, building them, implementing them, testing them out, running pilots. And this is where people are starting to find out we really kind of need to work through what principals and leaders really need to know and be able to do to support the teachers who are supporting the children. So we're in a little bit of a conundrum there. Competent leaders are critical to supporting a continuum of growth. 3, focus on workforce development to include all individuals who interact with and develop programs and interventions for children. Looking at existing states' efforts in aligning and further developing core knowledge and competency frameworks for all early childhood roles, not just teachers, administrators, program directors. Equally essential is to evaluate the capacity to understand our workforce and collect the data we need to understand our workforce better and make developments in our professional development and technical assistance systems to respond to the needs of our workforce. So 4, examine the progress of states toward developing their technical assistance systems. NEYC provides a good blueprint for this. We need to start thinking about in-service and pre-service together, not as separate, just like we don't want to think about the ages of our children separately. Competency is developed about the individual, whether you're in in-service or you're in pre-service. So how do we begin to measure that competency development? And adult learning, especially the neuroscience literature in adult learning, may help here in identifying how to do that from an in-service, pre-service perspective, not one or the other. You don't learn something different in service or pre-service if you're the same person. You've got to make it connect. So in conclusion, our efforts as state specialists depend on sound research.
Thank you. Thank you very much.
Thank you very much for having me here today.